What is salpingitis and its link to fertility? Have you ever wondered how infections can affect fertility? Salpingitis is a key player in this discussion. It refers to the inflammation and infection of the fallopian tubes, which connect the ovaries to the uterus. This condition is often a result of pelvic inflammatory disease, commonly caused by sexually transmitted infections like chlamydia and gonorrhea. The infection starts in the vagina and cervix, moving upward to the uterus and then to the fallopian tubes, causing inflammation that can be either acute or chronic. Symptoms of salpingitis can vary widely. Some people may experience lower abdominal pain, unusual vaginal discharge, or pain during sex or menstruation. Others might have fever or nausea. In chronic cases, symptoms can be mild or even absent, which can lead to the infection going unnoticed. This is concerning because untreated salpingitis can lead to serious complications. Now let's talk about its link to fertility. The inflammation from salpingitis can damage the fallopian tubes, leading to scarring, adhesions, and blockages. These changes can hinder the movement of the egg or sperm, making fertilization less likely. In some cases, this damage can result in infertility or increase the risk of ectopic pregnancy, where a fertilized egg implants outside the uterus, often in a damaged fallopian tube. From the perspective of fertility and endometriosis, salpingitis is particularly important. Both conditions involve pelvic inflammation and can complicate fertility issues. While endometriosis involves the growth of uterine-like tissue outside the uterus, salpingitis directly affects the fallopian tube structure and function. Therefore, managing infections promptly is crucial to preserving fertility and minimizing long-term reproductive damage. Certain factors can increase the risk of developing salpingitis. These include having multiple sexual partners, unprotected sex, previous sexually transmitted infections, and even the insertion of intrauterine devices. Young women aged 16 to 25 are especially at risk, as chlamydia often goes unnoticed due to a lack of symptoms. Treatment for salpingitis typically involves antibiotics to target the bacteria causing the infection. Early treatment is vital to prevent lasting damage to the fallopian tubes and to help preserve fertility. In cases where damage has already occurred, fertility treatments like in vitro fertilization may be necessary, as natural conception could be more difficult. In summary, salpingitis is an infection-driven inflammation of the fallopian tubes that can significantly impact fertility. It is closely tied to pelvic inflammatory disease and often arises from untreated sexually transmitted infections. Prompt diagnosis and treatment are essential to reduce fertility risks, making it a critical consideration for those facing fertility challenges or dealing with pelvic inflammatory conditions like endometriosis. Always consult a healthcare professional for personalized advice and treatment options.